morning. Dear audience, let me introduce my 3 months progress report. My PhD topic is investigating the potential risk of oral contraceptive use. I'm a Zsófia Tornyossy first-year PhD student, and my vision is to assure the safe use of oral hormonal contraceptives for all women, and my mission is to investigate the potential risk of oral contraceptive use. Here are our two ongoing projects. The first one is investigating the effect of oral contraceptive use on cancer risk, and the second one is investigating long-term oral contraceptive use and its effect on fertility. I would like to speak about this first project, so investigating the effect of oral contraceptive use on cancer risk. Today, 1.8 billion women are in the reproductive age group, and 140 million are using some hormonal contraceptive methods like oral contraceptives, vagina ring patch, and so on. In our study, we mainly focus on oral hormonal contraceptives. These contraceptives can be divided into two subgroups based on the hormone they contain. In the first subgroup are the combined oral hormonal contraceptives, which contain estrogen and progesterone. And in the second subgroup are the progesterone-only pills, which contain only just progesterone. These oral hormonal contraceptives may have an effect on the cancer risk. The literature suggests us this. In some cases, the oral hormonal contraceptives can decrease the risk of the cancer risk in the case of ovarian, endometrial, and colorectal cancer. However, the data are controversial. In other cases, it can increase it, for example, for the breast cancer. However, these oral hormonal contraceptives may have a time-dependent effect on term of use. So this suggests us that further investigations are needed to be done in this field of interest. So what is our aim? Our aim is to investigate the effect of long-term oral contraceptives on the incidence of the different cancers. For example, breast, ovarian, endometrial, and so on. What is the question? The question is, what are the effects of oral hormonal contraception on cancer risk? In our PICO, in the population group are women of fertile ages. The intervention group are the oral contraceptive users compared to the non-users, and our outcome is the cancer incidence. The clinical implication is that women on after the use of oral contraceptives should be followed more closely to detect certain types of cancer earlier. And our hypothesis is that oral hormonal contraception decreases the risk of ovarian, endometrial, and colorectal cancer, however, increase the risk of breast cancer. Our systematic search was conducted through databases, namely PubMed, Embase, and Cochrane Library. You can see the date of the search, and this is our search key. With this search key, we found more than 22,000 articles, and after duplicate removal, we have almost 18,000 articles. We did the Prospero registration and duplicate removal. The title and abstract selection in progress is going to be ready very soon, and we start the full text selection and the data extraction. The second project is investigating long-term oral contraceptive use and its effect on fertility. What is infertility? Infertility is the failure to achieve a pregnancy after 12 months or more of regular unprotected sexual intercourse. Many women have a misconception that a long duration of use of oral contraceptives may lead to infertility. Particularly, every woman who have ever experienced post-meal amenorrhea or fail to become pregnant within the expected date after the discontinuation of oral hormonal contraceptives, they can think that these oral hormonal contraceptions or contraception options can cause the return of delayed return of fertility. And this fear poses a negative impact on utilization and continuation of contraception. So that's why is our aim to show that oral contraceptive use does not pose a risk on women's fertility. The question is, what are the effects of long-term oral hormonal contraception on fertility? In our PICO, the outcome is different. This is pregnancy or ovulation. The clinical implication is that oral contraceptives can be used without fearing infertility. And their hypothesis is that long-term oral hormonal contraception does not have an effect on fertility. So this is our 2 ongoing projects. You can see the planned submission dates. And thank you for your attention. And a quote as a side note to my PhD: "Science is not finished until it is communicated." Thank you.
Thank you very much, Zsófia, for this excellent presentation. It's always difficult to give the first lecture of the day at a scientific session. And also thank you for keeping the time frame. I have to mention that we have to strictly keep that. So we are advised to stop everyone when you reach 4 or 3.5 minutes. But also you kept it perfectly.
So congratulations again for your really excellent and very important choice of topics. My question would be concerning that you have already mentioned the duration of taking oral contraceptives. So how are you planning to manage it in your meta-analysis? Are you planning to form subgroups, or do you see a chance to performing a kind of regression based on your preliminary research and your preliminary articles?
Yeah, thank you for the question. In a lot of articles, there are other subgroups based on the duration of use, but we see that about 5 years are the line that we can use under and over 5 years. So I think this is going to be the line between the long duration.
Congratulations to your presentation. I would be just curious for the second project, if there have been or has been any meta-analysis done so far, and if you can tell me any results if it was.
Yeah, thank you very much. Yeah, it was, but it was years ago, 4 and 5 years ago, the last one. The result was like our hypothesis, but since that there was a lot of other articles, so that's why we thought it would be a good choice to make a meta-analysis.
So my name is Anna Lenya, and I was wondering, how do you define the long-term use of contraceptive?
Yeah, thank you for the question. It's something like that we are going to make subgroups, and about 5 years, under or over 5 years, it seems to be a good choice. But in the literature or in books, there aren't any like this, that long-term like definition.
Hello, Zsófia. I'm Isabel, and I would like to ask you about the first project. If you're also going to analyze women who have already taken the contraceptives for a long period, for example, and they stopped and got cancer. So are they going to be analyzed as well, or only the actively taking the pills, the women actively taking them? Because it can be also a risk, maybe, if they just took the pill for 10 years and then they stop for 6 months, but they do not end up in the group of the... Yeah.
Thank you. We would like to, if we are going to have enough data. So it depends on the quality of data.